Now, with respect to the Linden Hospital complex over the number of years, one of our main challenges there is that we would have been functioning with one biochemistry machine. And whenever there's an issue with that machine, the service is done. But I can say now we have two functional biochemistry machines in our lab, so that at any given point in time, we have that services available. In respect to blood gas, it's the first time, HE, that we're seeing that persons of Region 10 now have access to blood analysis services at the Linden Hospital complex. In addition to upgrades that we would have experienced in our laboratory services, we would have seen tremendous investment also in our radiology department. 2 years ago, we would have upgraded our former X-ray system, which is mostly an analog system. The analog system, it used to take you roughly around 30 minutes to get that result. With the upgraded version, which is a digital X-ray system now we have in place, within seconds you have your results. So that is a great improvement for the people of Region 10. In addition to that, on Monday we will be commissioning our mammogram machine, and this also, why I mentioned these two things, Your Excellency, is that these two important, in addition to our CT scan machine, which we'll be getting this year, would reduce the economic burden of the people of Region 10 to access these services. In the past, persons used to have to travel to Georgetown to access these services. But now with this equipment in place, it will reduce the out-of-pocket burden for the small man within the region to access these services. And this is a great achievement for us in Region 10. Drugs and medical supply have been an issue for us when we took office, Region 10. Our supply was below 50%. Today we can boast of a system where our essential drugs, our vital drugs are above 90%. We would have put systems in place to ensure that every resident of Region 10 have access at any given point to essential drugs. Some of the systems that we would have put in place, one, we would have asked the service providers at all the healthcare facilities to have a 25% restock level. As soon as our stock levels at 25%, you have to restock. Secondly, we would have trained the number of personnel within the healthcare sector in LMIS training, which is basically logistic management training, to assist us to understand the forecasting procedure. So that would help us to do our forecasting correctly so that we cater for the amount of or have accurate data in terms of our projection. Thirdly, the government would have ensured that we have finances available at any given point of time to purchase emergency drugs so that patients at all times would receive or have access to healthcare delivery throughout the region. With respect to health transportation, this was something that was plaguing Region 10, especially in the outlying communities where persons, the healthcare workers, had difficulties taking healthcare to the people or doing home visits. Today we can boast that within our region, over 90% of our healthcare facilities in the riverine areas have a functional boat and a functional engine. And now they're taking healthcare to the residents. Home visits are being done on a monthly basis. And coupled with this, we have specialized medical outreaches on a monthly basis to those areas. And all of these different systems that we would have put in place is to reduce the economic burden of the citizens of Region 10. Because it doesn't make sense you offer free health care and then you have to pay a lot of money to access that. So we would have put systems in place to reduce that economic burden. And that is something that we're focusing on throughout that region, and in keeping with His Excellency vision also of creating a world-class healthcare system. The Ministry of Health would have invested in telemedicine across the region. We have 10 functional telemedicine sites in the outlying communities, and the central hub is at Mackenzie Hospital, where at any given point of time on a 24-hour basis, persons in the outlying areas have access to specialist doctors or consultants if there's an issue. Those are systems that we will continue. This is something that we will continue to build on. Our hope is to have all the outlining systems, all the outlining areas of our telemedicine center by the end of 2025. And this is something that we would have discussed with our minister, and he's very adamant, and we will accomplish this because this is the vision of His Excellency of creating a world-class healthcare system.